Hi, I'm Brendan Marr, College Chair-elect, taking over the role of College Chair following our AGM this Sunday. I run Mind Healthcare, a private bulk billing practice in Geelong, which I've done for just over a decade now. I'm passionate about providing a high-quality psychology service that's accessible to everybody. Whilst our current Medicare Better Access system has been a good start at increasing access to mental health services, I think a lot more can be done to expand services both in the private and public health systems. It was with this in mind that I decided to become more involved with the Clinical College and to join the National Committee. I have been a member of the National Committee now for 10 years in several different roles, including 6 years as Treasurer and the last 2 years as Deputy Chair and Chair-elect. Whilst it's hard work and all done by volunteers, I would very much recommend joining the National Committee to anybody who's interested in contributing to the future of the profession. We have been so fortunate to have the number of amazing volunteers that we have had on the National Committee over the last decade. Being able to interact with these people and to learn from them has been a very rewarding experience for me. Often the advocacy work that the college does can appear quite vague, and it can be hard to measure the effectiveness of it. As a result, it's been particularly satisfying to see the recent developments with regards to the telehealth items and also the soon-to-be available eating disorders items. For those intimately involved with the work of the National Committee, it is quite clear that the advocacy work of the college and our rationale for these items was definitely recognised by government when these items were introduced. Thank you for coming along and supporting this year's conference. A lot of work goes into the organisation of these conferences by the conference chair, Lisa Chandler, and her organising committee, as well as the amazing work of the APS events team. Some of the best feedback that we get from members and tips and ideas for the future work of the National Committee comes from informal chats with members at our national conference. So please feel free to come up and chat to me or any of the National Committee members. We would love to hear from you, any ideas that you might have about how we can further the profession of clinical psychology in Australia. I look forward to meeting you and I hope you enjoy the conference.
Hello, my name is Dr. Gemma Sharp and I'm the Early Career Representative on the National Committee. I run my own private psychology practice in Melbourne and I'm also a postdoctoral researcher at Monash University, funded by the National Health and Medical Research Council. I joined the Clinical College as a student and have been a member ever since. I jumped at the opportunity to be the National Early Career Representative back in 2017 and have been a part of many cool new initiatives through this role. I think the most memorable has been our new and improved mentoring program called the Connect program. And if you're not already involved, please do get in touch. I think now is a really important and challenging time for clinical psychologists in Australia. And I think through my work with the Clinical College, I feel like I'm helping to keep our voice strong.
I'm Diane Whiting. I'm the current Secretary and e-newsletter editor on the National Committee. I've been with the APS for 25 years. I joined in the second year of my undergraduate degree. Like everything, I just seem to do things a long way. I did the 4+2, worked full-time for another year, went back and did my master's part-time, and then went back and did a PhD part-time as well, which took far too long. In my role as an e-newsletter editor, I collect articles, so if you have something of interest that you might like to contribute, please contact me through the e-newsletter. There's a link there that you can click and send me an email. We're interested in your reflections on your clinical practice, anything topical that might be interesting, a book review, a PD event review, or even some early research you might be working on. With regard to me personally, my career's mainly been in New South Wales Health, where I worked for over 13 years, and in the area of traumatic brain injury rehabilitation, where I also completed my PhD. I'm fairly excited. I just received a grant to continue my PhD research and extend it into telehealth. My next challenge on the committee is to take on the 2020 conference chair, So I hope to see you all in Brisbane in 2020. Thank you.
I'm Dr. Lisa Chandler and I'm a clinical and consulting psychologist in Adelaide, South Australia. I run a boutique clinical practice focusing on the assessment and treatment of anxiety, depression and trauma for adolescents and adults. I also have training in forensic psychology and work in assessment and treatment of offenders and for the various court systems. I am the current conference chair for the APS National Clinical Psychology Conference. I joined the APS as a clinical student many years ago because my mentor at the time said I should, and I have remained a member ever since. I joined the clinical college as fast as I could, way back before Medicare and endorsement, in the days when clinical psychologists undertook basic neuropsych assessments and had a go at most clinical problems that walked through the door. My first experience on the National Committee was as State Chair for South Australia, and I soon realised how important the National Committee was and how they worked so hard for the betterment of clinical psychologists, and I wanted to be part of that work. I see my role as one of service to the community of clinical psychologists nationally. There's not much about clinical psych that I don't enjoy, so I guess that makes me a kind of proud psych nerd.
My name is Dr. Carl Wiener. I work as a senior lecturer in the School of Psychology at Charles Sturt University in Wagga Wagga, teaching ethics and current issues in psychology and psychological assessment. I also coordinate a master's dissertation subjects and also supervise a number of research students. Apart from my teaching roles and supervisory roles, I also run an after-hours private practice, seeing mainly GP and psychiatrist referred clients who suffer from low prevalence mental health disorders. I joined the APS in the mid-80s after completing my 4th year training in psychology and became a fellow of the Clinical College of Psychology in the mid-90s. Since then, I have served as the Riverina branch chair and currently serve as treasurer and membership secretary at the National College of Clinical Psychology. As you can see, I joined the APS at the beginning of my career as psychologist and later clinical psychologist. I saw early on the value of belonging to the professional organization. I am proud to share my knowledge and expertise with the Clinical College for the development of our profession, to maintain and build on its relevance for the discipline and the community at large. The current clinical conference is testimony for the Clinical College's commitment for providing its members with training in evidence-based interventions and also a platform to network with scholars and psychologists from different countries. I hope you enjoy your learnings and at the same time having fun, making fruitful connections with your peers. Thank you very much.
Hi there, my name is Brianna Moranti. I'm the National Student Representative of the APS College of Clinical Psychologists. I've recently finished my Masters in Clinical Psych and I'm looking forward to joining the workforce this year. My interests involve working with older people over 65 and more recently the psychological management of chronic pain. My earliest memories of being interested in psychology were perhaps in year 8 or year 9 where I'd be on the bus riding to school and I'd be just watching people trying to work out what they were thinking. I can confirm that didn't work, psychs can't read minds, but it certainly stimulated an ongoing interest in the field. Fast forward to my first year of Masters, I began attending the SA branch clinical college meetings. There I enjoyed keeping up to date with relevant matters to the field and I learned a lot about advocacy and organising events from the hardworking SA committee. From there, I guess I wanted to be further engaged and to cut a long story short, I was very fortunate in being afforded the role of the National Student Rep. I've been in the role for about a year now. I see it as one of investing in our postgraduate clinical psych students who are the future of our profession. Ultimately, I really am so privileged to be a part of such a hard-working, enthusiastic and dedicated team of clinical psychs who are so committed to furthering our profession and furthering our work conditions.
Hi, I'm Julie McConaughey and I'm the Chair of the New South Wales branch of the APS College of Clinical Psychologists. I'm committed to the promotion of psychologists in the general community because I believe a highly trained workforce can only benefit the long-term mental health of Australians. Many years ago, I did a PhD in psychology at the University of Adelaide, and then I worked as an academic at both Adelaide and Flinders universities. I then went on to the CSIRO, Division of Human Nutrition, where I researched ways to educate and change people's diets to reduce their risk of heart disease, hypertension and stroke, so as to improve the long-term health of the Australian community. I joined the Clinical College in 2015 after having been a member of the APS since 2002. I was concerned about the divisiveness in the APS and thought it was important to recognise and support the additional training clinical psychologists have completed. Thank you.
Hi, I'm Dr. Sarah Quinn and I'm an early career clinical psychologist based in Canberra. I currently manage psychological services within federal government, and I also have my own private practice in which I see primarily individuals with a history of trauma. I first joined the APS as a first year psychology student. Soon thereafter I joined the APS Clinical College, and soon thereafter that the Clinical College Committee in RCT. At the time, I had no idea what to expect from my APS Clinical College membership, but what I did know is that all the Clinical College members that I knew were incredibly supportive, knowledgeable, and very willing to dedicate their time to mentoring the students around them. So for me, it was a no-brainer. As I steadily moved up in the roles in the Clinical College Committee, so from student representative through to secretary to chair-elect, and now as my current role as chair, I also became very aware of the broader support that the National Committee offered to our profession. I see my role on the National Committee as one of service both to the ACT Clinical College membership and service to the broader membership nationwide. And I guess you could say I'm a bit of a cliche because I really want to be able to give back to a profession that supports and nurtures me as a clinical psychologist.
Hi, I'm Beth Sinclair and I'm the current Registrar Representative for the APS College of Clinical Psychologists National Committee. I've been serving in this role for about the past 18 months, and I've been working really closely with the student representative and the early career representative to advocate for issues related to the next generation of clinical psychologists. I work in private practice, and I also spend my time finishing the final stages of my PhD in clinical psychology at the Australian National University in Canberra. I'm also a registrar, which means I'm really familiar with a lot of the challenges that registrars are facing, the issues that are coming up, and some of the questions and concerns that they have. Together with the student representative and the early career representative, we've been working really hard on advocating for some of these issues and launching projects to try and support registrars, students, and early career psychologists. One of these projects is the Connect program, which we recently launched, and we've been really focused on trying to connect up-and-coming registrars and clinical psychologists with professionals who are more experienced and can provide mentoring and advice to them. It's been really enjoyable to be working in this role, and I've learned a lot about clinical psychology, some of the issues facing our profession, and how we can move forward as one. I really look forward to continuing to work with the committee, and hopefully you'll be able to see some new things coming from us that really support you as a registrar or as an early career psychologist in the future.